Dental care. So, again, I can't say enough prevention, prevention, prevention. It's like us. There's really no difference other than we don't have to be put under a general anesthetic. So it's almost even more important to try and keep your dogs and cats' teeth as clean as you possibly can. So you can brush them with coconut oil and use a mixture of coconut oil and probiotics together. You can use a toothbrush or a finger brush. You can get ice cubes and you can make them out of coconut water, coconut oil, and probiotics, and they can chew on the ice cubes. A big favorite, raw meaty bones. And then another one you can do is actually adding probiotic to their water bowl so that when they're drinking, the probiotic actually covers their gums, washes through their gums and on their teeth. So if your vet is recommending an anesthetic, please make sure that 100% that is in fact necessary, because there's not, there are other options besides doing an anesthetic just to do a teeth cleaning. There's statistics out there that bones will using raw meaty bones like big bones and femurs. They've done a study now to show that in 5 days there's more than I think it was 70% of the plaque was removed. So there are way better ways than just running out and doing a general anesthetic to clean their teeth. It's a bit different if there's a fracture in their tooth or something needs to be removed. That's a different, we're dealing with a different thing. But I know cats and dogs that go in for routine dental anesthetics and dental cleaning every year. And the stress of that anesthetic and that cleaning is really, really unnecessary if you're a pet parent that is willing to make sure that you're dealing with dental hygiene with your animal. But if they do have to have an anesthetic, make sure that you get a pre-surgical blood work done. I don't care how old your animal is, you should definitely get that done. If it comes back and there's an issue with kidneys or liver, then those organs 1,000,000% need to be supported for about 3 months and then retested before the procedure is done. The next thing is, there's a concern about periodontal disease or a really bad overgrowth of bacteria while you're trying to support the liver or kidney. So let's say you have an older animal, they go in, they need a dental cleaning, they do a pre-surgical blood work, and yikes, their liver or their kidneys are not in very good shape. And you go, okay, so my gut's telling me that I want to support these organs prior to having a surgery done or an anesthetic done. What might happen is they might say to you, which is valid, that the bacteria from the periodontal disease or the bacteria from their dental disease is showering on their heart valve, is causing the kidneys or the liver to get worse because of the toxins, and it's valid. But it's still, if it's been like that long, chances are supporting the liver and kidney to just give them a better chance prior to is going to be much more helpful than just running in and doing that. And when you do it, what you're doing by using arnica, pepper sulf, and silica, you do it 30C twice a day for 2 weeks. If it's helping, then you can continue to do that once per week until the surgery date. And what that will do is that will help with the bacteria that is being filtered through those organs, waiting for the actual surgery to happen. So if there's extensive dental disease with many extractions, here I go again. I'm a big supporter of board certified dentists or board certified anything, surgeons, board certified orthopedic surgeons. And it always cuts down on your animal's time under a general anesthetic. And why I'm saying that is for the same reason that I said about bone surgery. When all they're doing is dentistry, they can get in and get out really fast. And that's vital that's vital when your animal is old and under a general. The longer it's under the general, more often it's under a general, the more complications, long-term complications are going to happen. So if you can get to a board certified dentist, they can go in and get out. That's ideal. After the extractions and after the surgery, uh, homeopathic support would be to give 200C phosphorus right away. And that helps again to filter, really helps to filter specifically anesthetic out of the liver and kidney, along with supporting blood loss, because there's a lot of bleeding when you do teeth, a lot. And then give arnica 1M, hypericum 1M twice a day for 2 to 5 days, depending on the amount of work done. If it's been a lot of work done, I would not be concerned about giving it for 5 days, even a week. So many veterinarians, including holistic vets, do not believe in hand scaling. But again, this is all coming from my personal experience in my clinic. I find it to be really effective if you follow the really stringent protocols that a good hygienist would use, which would be getting a qualified tech who's patient and uses a high pressure rinse with coconut and hypericum solution in it. The next thing is, again, give arnica and 1M and Heparsol 200C twice a day for 7 days following the procedure. And this is one thing that at my clinic, when it was being done, I was adamant about, and it really upset a lot of people sometimes, but I never let them do it in more than 4 sessions. So I would get them to do the top half, one side of the top half. They'd go home a week later. They would do the other side of the top. They'd go home and then they would do the bottom and then go home and do the other side. And the reason that I do that is for 2 reasons. One, so that they don't get so stressed that you can never do them again. So that they're, they're in there for like 6 hours getting their hands scaled, and then they never want to come back to your clinic again, or they never definitely don't want you to touch their mouth. And the reason that we're doing this is to try and keep them so that you can do it often, right? So that it doesn't get really bad, so that it's quick and easy. And another reason is if they do have sensitivity, they can still always chew on their opposing side of their mouth.